People who had COVID-19 may have lingering chest pain for up to a year. Researchers with Intermountain Health, it's a nonprofit healthcare system in Utah, examined more than 140,000 patients, and they found people who had COVID-19 experienced a greater degree of chest pain for up to a year after their initial infection compared to people who didn't get the virus. Now, while they didn't find a higher risk of heart attack or stroke, the study lead author said that the persisting chest pains should be taken seriously. In addition to chest pains, other symptoms of long COVID include brain fog, joint pain, and extreme fatigue. For the latest on this and all of the symptoms and concerns surrounding long COVID, because we are still in a endemic at this point, we're joined by Dr. Pernell this morning. She is a public health physician in New Jersey. Doctor, good to see you. So this clinical trial published on The Lancet, COVID patients who took the diabetes drug metformin were less likely to develop long COVID symptoms. How significant is this?
I think this is fascinating information, Marni, because metformin is a drug that is readily available and is typically used to treat patients who have diabetes. And what this study showed in approximately 1,000 patients with 3 different arms, looking at metformin, looking at ivermectin, and looking at fluvoxamine, that metformin actually did reduce the incidence of long COVID. And whatever we can do to prevent that mass debilitating event, which is long COVID across this nation, is going to be beneficial in our continuing going forward.
So does metformin fight all symptoms of long COVID, or is it just fighting the chest pain that I just mentioned? What does it do?
Well, we don't have a tie or direct link that the metformin is fighting the chest pain. What we know about the metformin is we suspect that it is reducing inflammation in the body. And because it is reducing inflammation in the body, it's reducing those symptoms that can be associated with long COVID. The metformin also may be reducing oxidative stress that the cells are under. And by doing that, again, you see a reduction in the symptomology. What the Intermountain study showed, which was different, which is also interesting, is that those who have experienced COVID and have had long COVID, they are still presenting with chest symptoms as far as 6 months and 1 month out. But what it makes me think about more, Marni, is this somehow related to POTS, postural orthostatic tachycardia, which we know has increased in people who've experienced COVID.
Do you have any concerns about this clinical trial? And then what's the next step to get it to market if it is in fact helpful?
Well, no, I don't have concerns. It's early evidence. That's how we look at it, right? We need additional evidence. And I'm referencing specifically the clinical trial that looked at the benefit of metformin. Metformin is a drug that is readily available and already in our toolkit. As I mentioned, is used to treat those who experience and suffer with diabetes. So as we continue to have mounting evidence and data that this could potentially help those who had experienced post-COVID syndrome, that would be very, very, very welcomed. In addition to that, if we can understand the types of symptoms that people are continuing to experience, that means we can investigate other readily available drugs to see if they could have a benefit.
You know, we're right at about the 3-year mark of when COVID entered our lives and everything changed forever for so many people drastically. In terms of who is more impacted, we're learning more every day about COVID. Who's more susceptible to the symptoms you're talking about, long COVID systems? Do we know that yet?
We don't know that definitively, I would say. I would say we have interesting data. We know that women have shown symptoms of long COVID, but we need more comprehensive data. We do know that COVID was disproportionately devastating in Black and Brown communities, those who have been historically excluded throughout the history of this nation because of health inequities and health injustices. So we want to make sure that those populations that suffered the brunt of the COVID pandemic, including those who are elderly, are also protected from long COVID. And just more broadly, that we have a better understanding of how the body responds to the infection and how best to keep the most of the population healthy and whole.
Are you still seeing, Dr. Pernell, the same sort of vaccine and booster fatigue that we were starting to talk about kind of late summer, early fall last year?
Definitely. With only approximately 15% of the eligible population having received the bivalent booster, we know that there is fatigue. We know that there is fatigue about the pandemic in general.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.